8 studies is to provide oral cryotherapy, which is the application of cold or ice to the oral cavity as a nursing intervention for adult oncology patients who are receiving chemo or radiation therapy to prevent or reduce the severity of oral mucositis. According to research by Colella et al. 2023, oral mucositis is a condition involving pain, inflammation, or open lesions in the oral mucosa, including inside the mouth, gums, tongue, throat, and it often occurs in oncology patients who are undergoing chemotherapy or radiation therapy for the treatment of cancer. According to Colella, this can cause severe pain that impacts a patient's ability to eat, swallow, speak, leading to nutritional deficiencies and secondary infections caused by open sores in the mouth. This increases lengths of hospital stays and just decreases the patient's overall quality of life. Members of an external audience that would benefit from this recommendation includes healthcare providers outside the recommending organizations, such as oncologists, oncology nurses, outpatient clinics, palliative providers, or even large organizations like the ONS, which is the Oncology Nursing Society. Stakeholders involved in the implementation of the recommendation include nursing staff, patients, family members or caregivers, providers within the organization, dietitians, nurse managers or supervisors, and quality managers. According to FAIN 2024, some methods to reach and involve stakeholders include poster presentations or oral presentations to provide an opportunity to present the evidence and open a dialogue for questions or critique. And this can be done during huddles or staff meetings. According to FAIN 2024, to reach an external audience necessitates a larger or more formal way of communicating, such as publication, perhaps in the form of an academic journal or conferences. The content that you would be giving to this audience would include evidence and outcomes from the studies that show the benefit of the recommendation. For example, according to research provided by both Grossman et al. 2022 and Mancheri et al. 2024, benefits of this intervention include not only a decrease in the severity of oral mucositis in oncology patients, but it's also proven to be cost-effective for both patients and organizations, since it is a cheap intervention and can potentially reduce the length of hospitalizations. So this would be necessary content to emphasize when speaking to stakeholders and audiences, as well as just the relevance of the intervention to the oncology population. Sharing the evidence and content with the interprofessional team, such as dietary, providers, nursing staff, nursing leadership. This can be done during rounds or the interdisciplinary meetings like huddles. This could include clarification of roles and responsibilities regarding the intervention. For example, nurses would be the ones that would implement the intervention itself, and they would need to know how, what to document, how to document, as well as providing education on the intervention. Nurses would also need input from pharmacy and providers on which patients are even eligible for the intervention based on the chemo regimen or the radiation schedules. And nursing and dietary could collaborate to ensure patients are receiving proper nutrition and documenting any improvements or changes in their nutrition status. Critical elements related to dissemination of the intervention is to engage with the specific audience, whether it's internal or external, and presenting the information either orally or utilizing visuals such as handouts or posters. And again, this can be done during staff meetings or huddles or even in a more formal way of presenting to upper leadership or administration. To implement the intervention into practice would require training and education for stakeholders, including designating roles and responsibilities, interacting with supply chain to ensure resources are available, and coming up with a way to ensure that we're able to document the intervention for compliance and to monitor the effectiveness of the intervention. Required resources for implementation. So financial resources, even though oral cryotherapy, according to the research, is generally a cheap intervention to implement, there's still some financial and physical resources to consider. These include ice machines, which are typically available in hospital units, and it becomes a huge inconvenience when these things are out of order or don't work. So they have to be well maintained by staff and readily available. Other resources that are typically available, gloves, cups, towels, things like that. Enter professional resources. These include education materials, either physical or electronic, just to ensure everyone on the team is on the same page and we can hold everyone accountable for knowing what's necessary to know and what roles and responsibilities are. Everyone being the mentioned stakeholders, providers, nursing staff, nutritionists, nursing leadership, and educators. To implement policies and procedures, again, it would be necessary to establish those roles and responsibilities among the team. Eligible patients would also need to be established, as well as timeframes for application of the intervention. Documentation of the process would need to be implemented in order to prove compliance among the staff. And when these elements are clear, then the intervention can be more readily put into practice by organizing a procedure that can be referred to by the team when needed. To disseminate a plan to promote the evidence-based intervention, critical elements of the research should be emphasized to the specific audience. In this case, an external audience would be an outside oncology provider that's not a part of the recommending organization. As mentioned, some of the principal elements to share include the relevance of the intervention to the patient population, this being the oncology patients that are receiving chemotherapy or radiation therapy that are suffering from the oral mucositis, sores inside the mouth. You would need to share the research and evidence promoting the effectiveness of the intervention and also the low cost of implementing it. An effective way to share this information to outside providers would be to get into contact with your organization's nursing educator on how to present your research. This could be in the form of a presentation or written research, and it could be shared at a conference. For example, my institution's educator selects projects annually that are made by our nurses to submit to oncology seminars and conferences, just as a means to get some research out there and share it with a broader audience. Some barriers that could be experienced during implementation is staff and team compliance with implementing it. When a new procedure is put into place, there tends to be resistance to these changes. It can be a major barrier in implementing new interventions. Nurses probably sometimes feel they don't have the required education, or there's time constraints that hold them back from implementing a procedure. But this comes back to interacting with leadership and planning, just to ensure we have the required resources and education. Also, patients receiving chemo and radiation, they may not want to participate in the intervention. So again, education is just a huge part of implementing this. so that they know what's going on and they know the benefits of the intervention. Family and caregivers know the benefits of the intervention if they're eligible. Dissemination barriers could include not being able to reach the desired audiences, like outside oncologists or other organizations, and this could be due to financial or time constraints. Even reaching or gaining, attention of the internal audiences, like in nursing management or quality management, could be an issue, and that could be also to time constraints or just the inability to implement new procedures at the given time. Thank you.